Thank you for joining me again, and I'd like to say that as a disclaimer, I am not a medical professional, and for any serious questions, you should still consult your doctor or local physician. So today we're going to talk about diabetes, and these are like quick facts, so it's nothing in deep, it's nothing in depth, sorry. Um, Something you guys should know is the fact that, I'm not new to diabetes. So while I have a few tips, they're just things that I've heard that have worked. But let's start off with the different types of diabetes. Not only are there over 12 different types of diabetes, but the 12 that I can name start off with diabetes 1. There's also type 1.5, also abbreviated to LADA, L-A-D-A. Then there's type 2, and there's even a type 3, which I didn't even know. You got gestational diabetes, which you can also know or will have heard of as pregnancy diabetes. You've got MODY, M-O-D-Y, another abbreviation. Double diabetes, steroid-induced diabetes. You've got juvenile diabetes, brittle diabetes, secondary diabetes, diabetes insipidus. You've also got neonatal diabetes mellitus and prediabetes. So most common types in order: diabetes type 1, diabetes type 2, gestational diabetes, also pregnancy diabetes, and of course prediabetes. So what is type 1 diabetes exactly? Well, first of all, it's an autoimmune disease. Think of it as your immune system accidentally attacking parts of your body. So far, it is unclear exactly how to stop it or completely cure it, since it attacks specific cells, beta cells, until your pancreas can no longer produce insulin. Hence why people that take insulin shots do so to make up for the death of their beta cells, which are responsible for creating the insulin with the pancreas. Usually diagnosed in young children. It does not mean that someone with type 1 is overweight, but usually have higher than average ketone levels. And of course, upon diagnosis, this is discovered, and they will usually be insulin shot or pump dependent. What is type 2 diabetes? Type 2 is not an autoimmune disease, since it doesn't attack the beta cells, but instead is insulin resistant. In other words, it is just the body's inability to respond to insulin. Instead of a decline in insulin, the body produces, Instead of a decline in insulin, the body produces more insulin, but it doesn't always produce enough. Inadvertently, over time, the strain destroys the beta cells from the level of insulin production, thus depleting insulin production. Typically, those over the age of 30 will be diagnosed with this type of diabetes, and usually associated with excess body weight. High blood pressure, high cholesterol levels, or even both may be found at time of diagnosis. And type 2 can be treated initially without medication, or it can be done with tablets, and it is possible to avoid or come off of medication. So you don't have to be insulin dependent on type 2 diabetes, and in fact you can actually avoid having to have any medication or tablets used. And I know someone who's a great example of that, but I'll tell you that later. So what exactly is gestation diabetes? Well, it's also just a fancy name for pregnancy diabetes. So this happens when there is a high blood glucose level, known as hyperglycemia, during pregnancy. Typically, it's tested and diagnosed between 24 and 28 weeks of pregnancy. That's typically the second and third trimester. Usually it disappears after the baby is born, but it can develop into type 2 diabetes later in life. And there are the few cases, so don't think that if you have it, you won't have it after pregnancy. There are some women who, even after pregnancy, they still have the diabetes. The hormone changes that are made by the placenta that resists insulin in the last 2 trimesters, plus the demands of the fetus, increase the pregnant woman's insulin needs by 2 or 3 times that of normal levels, which is what will determine the presence of gestational diabetes. So in more layman-like terms, women who are pregnant, they have to have more insulin naturally by 2-3 times the normal to function at a normal rate. If they don't meet this or exceed this level, they're generally speaking going to be diagnosed with gestational diabetes. So basically, in more specific knowledge on this, gestational diabetes is when your body cannot make this demand of insulin. Like I said, more or less. The sugar from the foods you eat will stay in your bloodstream and cause high blood sugars because the insulin can't take the sugar from the body to move it into cells for energy. Okay, now last one. What is prediabetes? Well, prediabetes is the stage before type 2 diabetes, when your blood sugar is higher than normal, but not yet too high to be diagnosed as diabetes. With long-term damage of diabetes, particularly with your heart, blood vessels, and kidneys, it may already be starting. So the damage is, either starting or your prediabetes, you're almost to diabetes. It affects both children and adults. So in the case of type 1 and type 2, age isn't relevant to prediabetes. And then, of course, remember that the same lifestyle changes that can prevent the progression of prediabetes specifically, but diabetes in general, in adults can also be the same potential help for children to return to their blood sugar levels back down to normal. So it's not just, women, and it's not just men. It's not just, little kids, and it's not just adults. It can happen at any stage. And remember that type 1 and type 2, generally speaking, it's not specific to just children. Some people that are adults can get type 1 and not type 2 because they didn't know it was a pre-existing condition or something that ran in the family or whatever those other health things are. And we will definitely have a segment of specifics on just focusing on the different diabetes throughout this year. So I got a few questions. So tell me here, do you have diabetes or are pre-diabetic? Do you know someone with diabetes? How many people do you know with diabetes? Have you looked into different ways to control or lower your readings if you do have diabetes or you're worried about having diabetes? And then even better, what would you like to know more about diabetes? Do you have any questions? I would love to answer your questions, and I am more than happy to do a segment just so I can cover that. So don't be afraid to come to me and post here, or even share with someone you know that has diabetes and say, hey, look at this. This is somebody who, is willing to answer your questions. And like I said before, I may not be a medical professional, but just like anybody in the world, I'm willing to do the research, and I'm willing to do it for you so you don't have to. What better way of getting information than being able to watch a quick video, right? And at the same time, getting the in-depth knowledge that you would look for or want that you may not want to go to the doctors and ask, and most people that I know really don't like to go to the doctors unless they absolutely have to. So, in this kind of day and age, self-care is really the new healthcare, and it's something that you're going to really want to get into if you really don't like going to the doctors. So here's some things that I would like you guys to know is I have family members who have diabetes, family members who've had family members with diabetes, and for part of my family, it literally is a risk factor in the generations. So, my grandmother, she has diabetes. Her dad had diabetes, but the difference is that his wife, so my great-grandfather, was taken care of by his wife to prevent the damages that normally diabetics who face it for a long period of time, and back when they didn't have the medical science that they have now, she did what she could to make sure he kept his limbs. So, understand that there's side effects to diabetes that can ruin your life if not taken care of or caught in time, or now in this day and age, there are solutions to the problem. And like you heard earlier, with prediabetes, there's preventative measures you can take so that you don't have to worry about it. Now, in the case of my other grandmother who was diagnosed with what I presume would be type 2 diabetes, I've never actually asked which kind she has, she's been able to avoid having to take insulin shots. And not only that, but she's done it by watching certain things that she eats. For example, lower the intake of your pasta. If you have to miss out on a meal, cut out dinner time. Most important meal of the day is supposed to be breakfast, right? And you want to get through the rest of the day by eating lunch, right? So maybe snacking when it comes to dinner time or just snacking throughout the day will get you by where you wouldn't have to worry about those things. But if you're going to cut out pasta at any crucial time, do not eat it for dinner in large excess, because pasta is one of those things that helps or affects your blood sugar And believe it or not, there's some people who end up with low blood sugar and have to eat like a certain amount. So you got to watch that stuff. Man, it would just be easier if you just avoided eating too many starches, for example, or sodium or sugar. Just like really watch those things. And we will definitely go into, specifics. And last thing that I would love to say that my grandmother's done that is amazing is, besides watching what she eats, she also takes a certain amount of aloe vera a day, like every morning, like a routine. And at night, she also takes and drinks, and as weird as this sounds, shots of tonic water. But she drinks specific tonic water. She avoids things that are in it. So you guys should definitely make sure that when you read the ingredients, if you don't know what that ingredient is and you don't have the time to look it up, probably isn't good for you. So just keep that in mind. And like I said, ask me any questions. Share with a friend, especially somebody you know who has diabetes or knows somebody with diabetes. I'd like to help, and I'd like to give you more information on this subject because I definitely can relate to it. And the last thing I want is for you to end up developing diabetes if you don't already, or to have diabetes and feel like you're stuck on, terrible medication that affects you. And I would love to provide solutions. So until the next episode, which will actually be on cortisol, the stress hormone,